And please don't hesitate to type your city, your country in the chat so we know where you are joining from. And we already have Kakisu Ibrahim Ahmed that has volunteered to share his experience with us. So once we start the session, I'm going to be turning towards him, but I'll briefly introduce the session. And I see some people have not yet turned on their audio. That's why I've left the slides. So that in 2 steps, you just click on join audio and call using internet audio, a second step to turn on the audio to be able to hear everything that is being said in the session. I want to say hello to Hassan Ali from Kenya, Abdul Razak from Katsina, Nigeria, Dr. Shahidullah from Bangladesh. Pauline that's joining from Nairobi, Kenya. Warm welcome to you, Pauline. And next week, as from Monday, we'll be entering another key phase in the full learning cycle. That is the situation analysis. So I hope you are bracing yourself for that start. So it's midday in Geneva. And we are going to start with today's technical support, today's experience sharing session. So warm welcome to you once again. It's always a pleasure for Dr. François Gasse and myself to welcome you for our experience sharing session using the EACH methodology. And yes, we are here to share experiences, life experiences with our voices based on challenges that we are facing in the field and actions, ideas, practices that we are doing to overcome these challenges. And the methodology we are using for experience sharing is the EACH, what we call the EACH hackathon, and it's short sessions, 30 minutes, in which a challenge owner puts forward his challenge and others come to share their experiences that will help the challenge owner to resolve this challenge without them prescribing what the challenge owner has to do. So it's not about you coming to tell the challenge owner, this is what you should do, this is what you should do, but tell us instead, you were faced, I was faced with this problem, and this is what I did. These are the results that I obtained. It is very, very important. But most important of all is that while sharing experiences is good here in this live session, it's also important for you to share your ideas in the ideas engine. So if you have not yet accessed the ideas engine to share your idea, I'm encouraging you to do so. We still have up till today and tomorrow to do so. And I'm glad to see that Dr. François Gasse is already here in the room with us. He's our guide on the side, and he's ready and available to listen to you share your experiences. Hello, François, and warm welcome to you. Okay, maybe François.
Hello. Well, I'm not in an easy place to talk, but
okay.
I'm very happy to listen to the sharing, and maybe to, for me, it's more, my role is more to understand really the challenge or the idea that has been implemented to solve the challenge. So my role is maybe to ask for more clarification if the presenter does not give me or give us all the details for us to fully understand what was the challenge and how the idea that worked in practice. Thank you. Over to you, Charlotte.
Thank you very much, François. And before we started the session, Kakisu Ibrahim Ahmed has said he wanted to share his experience. So Ahmed, I'm asking you to unmute yourself. Kakisu Ibrahim. Are you able to do so? Okay,
yes.
And please do start by introducing yourself. You'll first of all share with us. We will be answering basically 2 questions during this session. The first one is, what is your most difficult and important challenge, and what support do you need? And the second question is, what is the idea or practice that you want to share? So Ibrahim, you're going to start with your challenge, and then you tell us what you have been able to do. Okay, so over to you, and please do start by introducing yourself.
Okay, thank you. So my name is Kakis Ibrahim Mohammed. I work with State Primary Healthcare Management Board, Kano, Nigeria. So my greatest challenge is the issue of low intake of second dose COVID-19 vaccination. So this is my major challenge. So what I have done to code this problem.
If I could ask you, what is the current coverage? What is the current coverage for the second dose? That is for the first dose, first and foremost, and the second dose in your context?
It's 74% for the second dose.
Okay, and the first dose?
The first dose we have, although we don't have the first dose, the number we're supposed to immunize for the first dose is, for instance, we immunized 2 million clients. So out of these 2 million for the first dose, 74% of them get their second dose.
Okay.
Before this intervention that I worked with to make it improve the coverage, we are at the 40-something%. We are at the 45% at that time.
Okay, so tell us what you did.
What I did is I make use of the filter tracking mechanism, where I employ sending an SMS reminder and direct phone calls those clients who are due for second dose. So that is what we did, and we did it in a planned manner in such a way that on daily basis, the team will sit and call the people that are due. That make the number of clients to start increasing from that time up till now. So we are still doing that, and that make us to have great achievement in this vaccination. So we are still counting these successes. Thank you.
Okay, thank you, Ibrahim. Before you go, I'd like to find out from you. You said you did defaulter tracking. What were the message? What is the content of the message that is sent? If you send SMS messages or even the call on the phone, what was the message that was given to the people?
The first of all, we just greet the person as, for instance, a good morning. So we are sending this SMS from Kano State EOC. So I kindly remember that you have received your first dose on so day. So we are now due for the second dose. So you can kindly come to this vaccination site or come to any nearest vaccination site for vaccination. Thank you. We also call them like this. So as such, we just follow up with them. That is how we did it.
Okay, and for people that did not respect the appointment date for the second dose, did you try to find out what were the reasons for their failing to show up for the appointment, for the second dose appointment?
Well, for some, we have some reasons. For some, not all. And some of the reason is that they got an AEFI in the first dose. So as said, they are trying to stop coming for the second dose. Then we have to talk to them that AEFI is normal, and it's not something that will prevent them from doing the vaccination. That is just normal, like how other vaccines are. And by doing the second dose may not come again, that AEFI. So possibly maybe the first dose is the first time they are receiving the kind of vaccine. As such, they may have some changes in their body. But for second dose, they may not get that. We encourage them to come and collect the second dose vaccination.
Okay, so it's a fear of AFI. So right now I'm going to turn towards François. François, you have listened to the challenge that it was faced by Ibrahim. Do you have any additional questions for him? And I'll be inviting you also in the room. If you have had an experience, a challenge similar to that of Ibrahim, what did you do and what results did you obtain? François, any additional questions for Ibrahim? Okay, so I see, unfortunately, we have lost François, but that is okay. So I see there are some hands that are raised. Please remember, our each methodology is saying you are not going to prescribe to Kakisu what he's going to do, but I see Kakisu has already been able to carry out his action to solve the challenge, and it's producing results. Maybe one last thing I would like to ask you, Ibrahim, is have you shared this idea in the ideas engine? That is defaulter tracking of zero dose clients for COVID-19 vaccination. Have you shared this idea in the ideas engine?
Well, I'm yet to do that.
Okay, so have you accessed the ideas engine already?
Yes, I have accessed it. I have accessed it and started. I will just continue to finish it.
Okay,
Yes.
so by Monday, are you reassuring me that by Monday I'll be able to see your idea, because this is an amazing idea. I'll be able to see it in the ideas engine.
I will try to do it today, inshallah. By God
Okay.
willing. Yes.
Okay, that's great. Thank you. So let's turn now to the next person. That is Nelson Mandela Albert. Your hand has been raised for a while. Nelson Mandela Albert. So go ahead and unmute. If not, we are going to take, we are going to listen to Amsalu Shifero. I'm inviting you, Amsalu Shifero. Are you able to unmute? Okay, over to you, Amsalu, and please do start by introducing yourself and tell us where you're joining from.
Good afternoon, good morning. I'm Amsalu Shifero, joining from Ethiopia. I'm working for UNICEF country office. You hear me, Charlotte?
Yes, I can hear you.
Okay, good. I mean, the network is a bit bad. So the challenge that I faced is to sustain the progresses that were gained through our support. We had support the government through funds from donors in reducing zero dose and then increasing the coverage. What we did was initially we identify places where most of zero doses and underserved community are found. We try to categorize like in terms of conflict or security affected areas, far distances from health facilities and difficult geography, or with social characteristics like informal settlements, IDPs, and then so and so. So after we categorize, we define why they were missing this immunization, and we try to reach out to them through expanding the outreaches, and in some areas, enhancing periodic immunization activities, and then linking with other programs as well. Then through the monitoring the implementation, we were able to increase the coverage and reduce the number of zero doses considerably for like starting from 2019. And we used those approaches for advocacy and then feedback for the government officials at sub-national level. And then they were happy, and the government requested to switch the support to other zones and districts where much of the challenge is available. And actually we shifted to other places. But the problem that we are seeing now is those places where we were supporting, we are not able to maintain and sustain the coverage, and they are just going down. So the big challenge is how to maintain the sustainability and accountability from the primary healthcare people. I think that is what I just wanted to get inputs from participants and facilitators. Thank you. Over to you, Charlotte.
Okay, thank you so much, Amsalu. Before you go, I'd like to understand. I'd like to ask you a couple of questions. The first one is, what is the current gap in terms of coverage because of the, since the support is not yet, is no longer coming from partners, you know, what has what coverage did you move from to now? So what was the coverage before the support? What coverage did you attain during the support, and where is the coverage right now that this has become a challenge of sustainability of the results that were obtained? And I know this is a common problem that's almost everywhere, because at times we receive support to carry out immunization activities, and once the support, the funding ends, there is a problem of sustainability.
Yeah, actually, the improvement in coverage varies across districts, ranging from 3% to 17%. But an average for some of the zones, I mean, some of the average at when we aggregate at national level was like 5.7% of increase in those areas, but there are districts that were able to improve by like 17%, and there are also districts able to improve by 3% only. So when proportionally take those number of children as well, we were able to reach, particularly in hard to reach areas like 37,580 children.
Okay, okay. Thank you so much for sharing that. And if you can also share, you spelled out some of the concrete actions. So what if you, in a few words, what could be the reasons why is the government or the state, the district not able to sustain the results that were obtained?
I think we were able to transfer cash directly to the government offices. So the health workers had incentives to conduct outreaches and then follow with community. Also, some of the districts were able to organize community dialogue to improve the demand side. So I think it's because of mainly it might be attributed with budget. And then the second one is we had also consultants deployed at subnational level who frequently monitor, support, visit, and also improve the capacity of the health workers. So the consultants were moved to other areas, as well as the fund contributed for government to be able to do outreaches were also shifted to other zones. I think that is what we are thinking, but definitely we have discussed this with the health managers and authorities at subnational level next to national, but still there are gaps. Thank you. Over.
Okay, thank you, Amsalu, for enlightening us with those responses. Now you have listened to the challenge of Amsalu Shifero from Ethiopia that shared that with support of partners, they were able to gain up to from 3 to 17% in immunization coverages for Penta 3 in some districts in his country. But when the support of partners ended or stopped, they're saying that they are not able to sustain the gains. They're not able to sustain those results. If you are faced, or you have been faced with this kind of challenge, and you have an idea or a practice, how do you sustain the gains from partner support even after the support has ended? So that is the question that I'm asking. If you have an idea and experience to share around this, I'll be turning towards those who have, okay, I see François is back with us. François, let me just make you co-host so that you're able to unmute yourself. Okay, and François, please go ahead. I'm sure.
Yeah. Okay, Charlotte, I finally succeed to unmute. I have thank you for explaining very concretely your challenge of sustainability of the gain that you achieve by corrective measure, and namely outreach, which obviously were not taking place before you identified. First, I found your categorization extremely interesting. That means you understand which is the profile of those areas we're missing, because they may need different strategy to correct based on the profile of the area. What I was interested in is when you carried out those outreach and then you move to other area, was your budget, was it an ad hoc budget? Was it part of a long or semi-midterm project with a budget allocated? What was what was the issue behind fund allocation, or was it, as you say, a lack of support and the shift to another area and the area went down? Do they stop outreach? Do they stop the support? Can you clarify a little bit more what you have learned from that?
Yeah, the budget was ad hoc budget as we got from donors through concept papers and proposals. We distributed to those areas. We had no the regular budget that will be allocated for, rolling over years. That the budget was ad hoc based on the performance and improvements that we showed. We mobilized it from donors. And then it is because of the request from the government that we were shifted to other, they can say worst areas. So while we were discussing with the baseline and then the end line, they were very interested. So these zones and districts were supported for the last 2-3 years. The capacity is improved. They have all the approaches. So we have also other areas that have a very low coverage of immunization. So we appreciate if you could also move to those areas and then improve the coverage. That because of those requests, we were able to shift to other areas. But as I have said, most waradas were not able to sustain and be accountable for the coverage that was gained. Thank you.
One further question, if you have me, your budget was for 3 months, so all to pay for the outreach and the communication with communities and the support for the outreach implementation. Was it a 3-month budget? Is there any chance to have a yearly budget, or is it a big challenge for you to get a yearly budget to cover those outreach in those hard-to-reach areas?
Yeah, the transfer was actually biannually. Of course, the release is every quarter, but in some, in one warada, we only transfer through, twice a year. For others, like we transfer for 5 districts in the first quarter, for another 5 in the second quarter, and for the first 5 districts in the third quarter. That is how we were doing. It was actually based on the annual rolling out, work plan done with the government. But after 2 to 3 years, we were requested to shift those areas.
So those areas were a little bit abandoned for the reasons you mentioned, both in terms of support and financially and technical.
Yes, yeah.
And how, I think it's a very interesting area. Sustainability is a very key issue because you can, on short term, make a big difference. And then when you leave the area without money, without technical support, without a priority and focus, things go backward. But are you discussing those issues with locally, with people, with the stakeholder and the government, and how do you see a light in the future for supporting financially all year round those areas with strategies that seems to work?
Amsalu? Okay, let me ask to unmute. He's muted. Okay,
yeah. Yeah, thank you. I think our justification, while we were discussing with subnational level government officials, was the capacity of the subnational level in planning, monitoring, and implementing is improved. So the assumption is that the government can take over. And we were also suggesting to allocate some amount of fund for outreach to motivate service providers who are working at PHCU level, primary health care level. I think one of the critical issue was they were not able to allocate funds for outreaches. That is one. Otherwise, I mean, we were training them. The health workers were doing with technical assistants, consultants who has been deployed there. The assumption is the capacity is there already, and they can sustain. But as you know, motivation seems very critical. Unless you motivate health workers who are working at the ground level, things might not move. That is what I'm not referring. The capacity is already there. Probably it is the issue of motivation. They need to be motivated. They need to get some amount of money for the outreaches and periodic intensification that they are doing. Over.
Thank you. And I think maybe the participants have experience, trying to sustain a budget and the motivation to implement outreach, because outreach requires resources and vaccinators to execute them. So maybe there is experience in the room of people who manage to sustain an immediate achievement when you look at money and you motivate the people. Any experience in the field could be very nice to hear.
Yeah, definitely, François. That's why I'm going to turn towards participants in the room. I'm asking Professor Becky Tagbo. I'm trying to do some form of gender balance. Professor Becky, please go ahead. What is your experience in line with sustainability of the gains from this kind of activities as described by Amsalu Shifero? And please do start by introducing yourself.
Thank you. Hello, everyone. My name is Becky. I'm a professor of pediatrics. I work a lot in the immunization field. So we've had this similar experience in the past where we have agencies supporting a particular program or activity. And at the end, the moment they withdraw, the program ceases. So what we do now is
Can't hear you.
Unfortunately, Becky, we can't hear you. Probably connectivity issues. Please, can you check your connectivity? Becky, are you able to hear us? Unfortunately, we cannot reach. Okay.
Hello?
Yes, we lost you. We lost you for almost 30 seconds. So please, can you restart?
Oh, sorry about that. So I said, what we do is that before you go to carry out any activity that is going to be supported, you have to include in the plan sustainability plan, so that as the donors are withdrawing, you are gradually handing it over. So just like in his own case, I hope you can still hear me.
Yes, loud and clear.
Okay, so like UNICEF is going to support outreach for 0 dose. So that proposal will have a part of the plan for sustainability. You now say, maybe we're going to involve the community so that as we withdraw, they can sustain this. Or we can also say that we're going to educate the community as a whole, so that they see the need to immunize. So by the time we are withdrawing the outreach, we have created the demand. Or we're going to insist that government must cite a facility here as we are withdrawing. So this is all signed in that plan, in that proposal, in that budget. And so when you begin to implement, by the time you are withdrawing, you have a sustainability plan on the ground to continue. Thank you.
Thank you so much, Professor Becky. I just wanted to find out from you concretely, maybe what is the content? I know you have cited some examples, but I want maybe in one situation where you have been involved in a project in which there was a sustainability plan. What was the content of that plan, and how did it turn out at the end?
Yes, a particular plan that I was involved in. So the donors insisted, just like in his own case, UNICEF, that they met with the management and discussed. Management, you have to bring a counterpart fund that will be on ground as we withdraw. And so they have to sign an agreement with management. In his own case, now it will be with the government. So when they signed that, when they signed it in that particular case I was involved, what we did now is that you now create an account where government is putting its own counterpart fund, and that is the only condition for the donor to release their own fund. So when government does not release maybe their 10%, the donor does not release anything. So that forces the government to release their own part of the budget, and then the implementing staff can then make use of that fund to make plan for sustainability. So that is what happened in that instance.
Okay, thank you very much, Becky Takbo. I'm going to turn towards another hand raised. Remember, the challenge we are looking at is Amsalu Shifero's challenge on sustaining a project that is sustaining the gains in immunization coverage after after the stop of the funding from the partners. So I'm asking Chair Pilot. Chair Pilot, are you able to unmute? If not, I'll turn towards Said Zai. Said Zai, I'm asking you to unmute. Sorry, I said. I'm asking other people to unmute. Said Zai, are you able to unmute? Okay, and please do start by introducing yourself.
Well, thank you, Charlotte, for giving the opportunity once again. Well, actually, the outreach plan and these things. Sorry to introduce myself. This is Dr. Said Mehraban Shah from Afghanistan, working with WHO as a technical officer. In my experience, that work with the Ministry of Public Health and regarding this outreach and mobile strategies for those areas where the missed communities or zero-dose children are located. And even if it is about the COVID-19 or about the routine immunization, so the problem is the same, that we suffer similarly in Afghanistan, and the outreach sessions, and particularly in those areas before 15 August 2021, the country was, conflict was going on, active fighting was going on. And the conventional BPHS implementer, the basic package of health services contractor, was not able to go those areas. So the Ministry of Health in coordination with the partners, WHO, UNICEF, contracted with the private health service providers under the Taliban areas, and they were providing immunization services. But about the sustainability was a great issue, because the project was contracted for 1 year, and then a collapse in the program, and nobody was ready. Particularly the BPHs in their contracts, they mentioned that they are responsible for the entire population, particularly for the immunization services, but they were not comply or adhere with the BPHS guideline, and they were not providing immunization services under those areas, which was difficult, and they were not allowed to go there, and the outreach and mobile strategy was banned over there. So the contract come with the private health service provider. They were located over there, they were providing services, and they were acceptable for the people or community over there, and it was not issue for this to provide services. But actually regarding their knowledge, and I was involved in the assessment of this private health service providers, and I did assessment, and I found that in a study that we found that the knowledge about the vaccination was very low, and they were not able to explain in proper manner that which vaccine should be given at which time. So this was the issues out there. And the sustainability is a great issue in a country like in Afghanistan, where the is mostly donor dependent, particularly for the health service provision. And in the country, and currently also we are facing the same problem that the World Bank banned this stop they are supporting for the health sector in Afghanistan, but it is coming through the UNICEF and WHO, particularly for the essential hospital services is given to WHO, and the basic package of health services is given to UNICEF. The same problem is going on, and it is time by time, for example, giving for 5 months or 6 months, and then what will happen if there is no sustainability, there is no government budget for such program? So the program will collapse as collapsed in the past after transition after 15 August 2021. So the most of the health facility in the country was collapsed and stopped their activities, and for at least 1.5 months or 2 months the health services were stopped. But after that, they given the opportunity once again to the WHO and UNICEF to run the health system in the country. So it is very important that we should think about the sustainability of the program, but it is depend on the availability of the budget and funding for the country. And Afghanistan is very difficult to sustain a program, because most of the programs, the health sector is depend on the donors. If the donors,
Thank you.
Thank you.
Okay. Thank you so much for sharing that, Said. So we just want to, you're just saying that you are facing the same challenge as Amsalu, and you're looking onto peers in the room to share ideas on how you can have sustainable projects as far as immunization is concerned after the withdrawal of the donors. So I'm going to turn now quickly towards Chair Pilot, but before I Pilot, you take the floor, I just recognize that we are 5 minutes above the 30 minutes mark for this session. I didn't even see the time go by. So apologies for keeping you over time, but you know there is a question we always ask in situations like this. Do you want us to continue, or should we end here now? So if you want us to continue, please can you just type more in the chat, more. M-O-R-E, like I've just done in the chat, so we know whether we need to listen to more experiences. Okay, I see how Buhari is. Okay. So François, I'm going to ask François now. François, are you still available for more? François, I don't know, it's as if.
Yes, I'm available. I hope I don't get disconnected.
Okay, that's great. So I am also available for more of the experience sharing, because I think now we see we have Syed Zai and we have Amsalu that are facing this challenge, and will need your experiences to help them overcome this. So I want to invite now Chair Pilot. Over to, yes, Reda.
Hi, Charlotte. And hi, everyone. Very interesting session. I just want to ask, also to clarify, the reason Charlotte stops at the 30-minute mark is because we said this would be a 30-minute session. So if you need to go because of your work commitments, if you need to get back to work, please do so. Do not feel you're going to miss on a great discussion. You can catch up later, but we want to be clear that we hold to the 30-minute commitment for those who cannot do more or who do not see the need to go further in the discussion. Thank you.
Thank you so much, Rena. Yes, François.
What I would like to hear from the participants still on board, do they have a success story on maintaining the budget for the activities, not having just initial budget to achieve a certain coverage, but to sustain the funds needed to sustain the activities after the donor left or the budget is dry after the first phase? Do they have a success story with their 5-year plan, with a Gavi plan on 0 dose? I feel that very often the focus is on the short term, and we forget to look at the long term, especially when there is limited resources. But any success story to share?
François, talking about success story, there's a comment in the chat from Ninyere Kingsley that says SciDev did project integration when it comes to project sustainability by integrating immunization programs with malaria prevention and control, as well as Stop TB programs. So I'm going to invite Ninyere Kingsley to unmute. I hope, Kingsley, you're able to talk to us. Are you able to unmute yourself to throw more light on this experience and the results you obtained? Ninyere Kingsley, I've invited you. Unfortunately, François, it's as if Kingsley is no more in the room, probably issues of connectivity. So, but they said, and so they said, he said, with malaria prevention and control, as well as Stop TB programs when our funders, CRS and Gavi, folded up. So integration. And there also another comment from a participant in Ghana that was also going towards in line with integration. So I'm hoping that the 9 raised hands in the room will be able to hear a success story. If you have a success story on sustainability that started from the planning phase, I'll really be turning towards you. I hope I'm asking Jafar Sani to unmute. I hope you're able to unmute. Okay, over to you, Jafar, and please do start by introducing yourself. Jafar Sani, you're unmuted. We are listening to you.
Hello? Am
Yes.
I audible?
Yes, please go ahead.
Hello?
Yeah, hi, please go ahead, but there is some background noise. Can you pull away from the crowd, please?
Hello?
Okay, I see Jaffa. If you're not able to get you, maybe we'll come back to you later. I'm inviting Dr. John Busa Buala or Bilali Yafa. Okay, Dr. John Busa Buala, please go ahead. Your mic is unmuted.
Hello. Thank you for the opportunity. I just want to talk about a challenge actually, briefly. When I was working in northern part of Nigeria.
Dr. John, please, we want to listen to a success story on sustainability in planning. Yeah. So, and
okay. Let me talk about that. I just want to share some of the ideas about the sustainability, which I happen to be in a particular environment where I was working as a healthcare personnel, and then I noticed there's a poor intake due to the immunization and poor intake of the vaccines, and then so I noticed the problem was there because of the gender-based problems there, and I noticed that women particularly are not allowed to participate in the immunization program because of the agenda, and then sometimes it's religious and cultural beliefs. So what we do is then we decided to go to those communities, and then we produce IEC materials, and then we decide to educate them in relation to the SDG goals and 3, 4, 5, and then we try to meet with the religious leaders and also traditional rulers there, and then also how they can also be educated and on how to also educate your people on not to be having that gender kind of notion about of immunization, and then eventually we noticed that the uptake of the vaccinations in that particular community has increased over time, and then we noticed that as a result of the education and then the meetings that we had with them, and then that has resulted to the increase in the vaccination.
One question. Thank you. But one question, I'm happy you managed to get an improvement, but have you been able to sustain the coverage? I'm suppose that there was an investment to resource community, to talk to the community leaders, to talk about the vaccine and get an agreement and get suddenly more immunization of women and infants. But have you been able to sustain both the funding and the activities, or it was one time and it went well afterwards forever?
Please unmute.
Okay, I was working with a non-governmental organization there, and then so they were supporting us, and so they provided the funding, and then we also met with other organizations too, and then they also provided us with the funding, but it was not something that, it's not a long-term program. It's not something that we inculcated in the system. It was just for a short time. We did that for just a few months, and we're trying to educate, and then we just, and then after the project is closed, we focused on another thing. Thank you.
But is your courage maintained with the departure of the support? Have you been able, it was still an important element to sustain for the communities to demand and be accepting the vaccine. Is it sustained, your courage, when you left for something else with the NGO?
It was sustained, but then I think it was not our own organization that carried it. I think we decided to leave it to the state ministries and the state ministries of health, and then the local parastatals to continue with that. So I believe they continue with that, but then the funding from our own organization was not there at all, and then we no longer monitor, but I think it's sustained, and then up to now they are doing it, but I cannot tell you right now whether how far they are doing regarding the sustainability.
Thank you.
Okay, thank you, Dr. John. Thank you, François. There is a comment in the chat from Modupe, and whom I'm asking to unmute. She says, I am of the belief that going into partnership with the community members goes a long way, as they will be able to see it as their own project, thereby leading to its sustainability. So Modupe, I don't know if you're able to unmute so that you can tell us if this is a practice, this is something you have been able to do, and how did you do it? What results did you obtain? So I hope you're able to unmute. I'm asking you to unmute. Modupe, maybe Modupe is not able to speak to us. So I'm going to turn towards another person in the room. We still have many raised hands. Bilali Yafa, please go ahead and unmute yourself. Bilali Yafa, your hand is raised. I'm asking to unmute.
Yes, thank you so much.
Okay, please do start by introducing yourself.
Yeah, I am Bilali Yafa from Gambia, West Africa. Yeah, I'm working as a registered nurse in Gambia Ministry of Health. Yeah, I work in pediatric, outpatient, and so on. Yeah. So we were talking about the sustainability, how to get sustainability for immunization. Yeah, in the Gambia here, thank God, the sustainability that government is solely responsible for immunization activities most of the time, because some of the private hospitals, immunization is not very common there. Sure, but the government also makes sure that in terms of human resources, they are going to capacitize their people, like school nurses and public health officers are responsible for immunization, but like our development partners like UNICEF and the Gavi and so on, they are the ones supplying these vaccines. As we know, they are very expensive. And also, like this campaign, also national immunization campaign. Right now, in some few days coming, we are going to get into a polio campaign. So one of the strategies that government uses, they use these village health workers, both male and female traditional birth attendants. They use them to disseminate information, chiefs, alcalos, and others. So by the end of the campaign period, you will find out that they get the targets of the immunization. No, we are not talking about the challenges. We have challenges, but as far as we are talking about the sustainability, This is what I'm going to talk about. So sustainability, in terms of that, we are doing well in that area. Yeah.
Okay. Thank you for sharing. Yeah, François, please.
No, I'm okay. Okay. No, over to you.
Okay, thank you so much, Bilali and François. There is a comment here from Raoul. Raoul, I hope this time I'll succeed to get one of the commentators to speak. Raoul says in Cambodia, they utilize user fee and get support from social funds budget provided by provincial government to the health center to be able to carry out sustainable outreach. So Raoul, I hope you're able to unmute yourself to explain to us clearly how this is done and what results you have been able to get. So, and please just start by introducing yourself.
Yeah, Raoul speaking here. Can you hear me?
Yes, loud and clear.
Yeah, there is actually one province, you know, we just completed the health facility assessment in
Raoul, please, can you start by introducing yourself? Sorry.
Hi, I'm Raoul Bonifacio. I work with WHO as a consultant. I've been with WHO for the last 22 years. But this year I'm working as a consultant. You know, Cambodia is heavily funded by Gavi, but there are few provinces which are not under Gavi's support. And the government, I think because the government is also as well pumping economic support to the local community or to the provincial government. So we have one province called Kokong, and they have the provincial health department director basically don't want to utilize Gavi funds because of all the administrative requirements. So they do have available funds, which is supporting the health center, whether on a monthly basis, like $500 for like maintaining the infrastructure. Secondly, they also use the user fee and plus other funds within the health project. So it's a matter of management. You know, they have what we call an annual operational plan as well, both at the provincial, at the health facility level. So it is a smart move for these people to utilize other resources so that they will be able to carry out the outreach plan. So they have been quite successful, but the other provinces do not have results, you know? So I think it's a matter of this governance and leadership in a particular country. So that's the success story. And we just completed our review today. Thank you.
Okay, thank you.
One question.
Yes, François, before I come in my own.
One question about Cambodia. When there is discussion on management issue, as you say, and I think as everybody will support that management is important, when you have little resources, you need to make priorities. How those priorities set up? Can EPI get a priority to spend a lot of money to go to a remote village without other intervention? How is it negotiated? Because the budget are always limited. How do they negotiate the continuation of outreach?
Bonjour, François. I think it's the thing is that what this provincial health director did was the funds are available, social funds are available, and the user fee plus the other support funds to the health center. So it's a matter of utilization what is available funds. But this situation here in Cambodia may not be the same as in other countries. You follow me?
Yes.
But without, I think, giving the respect with other health projects. So it's a matter of utilizing what's in there and without being dependent, because other provinces actually do rely. And I think it's just also a matter of, as I say, when we discussed, when I met him a few months ago, and he just made clear that I do have funds from the government. And I think overall with the 90+ coverage of COVID as well, the importance of overall demand for immunization is quite high, even for a routine, although it's still very much dependent, as you know, on support from the partners. Over.
Okay, so basically you have resources available. It's just a question of using them well. And are those funds used for several programs or misused for many programs? And EPI comes and say we have a need and the money is allocated, or is there a tendency to integrate, like it was raised by several speakers, that when you have little
Yeah, I think most of the outreach, almost all outreach programs are integrated, especially with the MCH program. It is an integrated, I think we're also integrated into the malaria program, because the malaria program is trying to reach every zero. So when you go to the community, if you find out malaria worker is the brother, the mother is a TVA, the sister is actually the village health support group person. So it's really, when you go to the field, it's really a good community network.
And that's great, because of course, I think it's maybe harder to sell an outreach just for immunization, for using these funds than using it as a package for outreach.
It's always a package.
It's always a package. I think it's quite an interesting idea you're doing. Yeah. Thank you.
Merci.
Okay, thank you so much, Raul, and thank you, François. So I see so many other interesting comments on sustainability coming in the chat. There's one from Oneka Scott, from Regina Brobe, but I think we have to go. But one thing, it's important for you to share your experiences during these sessions live. We get to hear them, but it's even more better if you immortalize your experiences in the IDS engine. So I just wanted to ask Raul if he had Raul. There's Regina Brobe, there is Annika, there is Oneka Scott, and all the others who have shared ideas in the chat. Have you shared your idea in the IDS engine? If you have not yet done so, please, the IDS engine is still open. Even if you have already shared one idea, but that's different from the one that you're sharing today, and your hand is raised, you have something to share to help Amsalu Shifero and many others who have not attended today's session, but will need to are facing this challenge. Please, I encourage you, go to the IDS engine and share your idea. Even if you have already shared one, you can share as many ideas and practices as possible. So you are encouraged to do so. One other thing, I see, I just answered your question, Hawa Buhari, even before seeing it. Yes, you can share as many ideas as possible. One other thing I would like to ask you to do. Yes, Reda?
Yes, hi, sorry to interrupt, but just to say about the IDS engine, I think we may not have communicated this clearly enough, is that we are closing the first round of the IDS engine tomorrow on Friday. And that means that on Monday, one of the things we'll do at the Global Assembly is to actually honor all of the participants, all of the members of the IA2030 movement who have shared at least one idea or practice, and we'll be sending out official letters to recognize these contributions. So this will be the first certification in the movement, and the closing date is tomorrow. So if you haven't done it yet, it's important, we want to recognize your contributions. The deadline is tomorrow evening.
Thank you so much, Reda. That is very useful information. So if you have not yet submitted one idea in the IDS engine, I want to encourage you to do so, to go to the IDS engine right now and submit your idea, so that, yes, Reda just said, on Monday, you'll be recognized specially. And also on Monday, we are going to start real business. That is the situation analysis that will go on for 4 weeks. So get ready. We have been sending you so many mails, so many reminders in the past 2 weeks, because we wanted you to get familiar with the sessions we are organizing, to have them on your calendars, to be able to know exactly where to go, where to find what. But I think as from next week, it will be mostly, we will have understood that you already know your way around our various platforms. And so you will not be getting as many reminders from us as you have had over this past 2 weeks. But then if after that, you're still having any challenges in terms of how to access the various platforms, I'll invite you tomorrow, join us tomorrow at 1:30 p.m. Geneva time for the technical support session. And one last thing I would like to invite you to do for me before I hand over to François to just summarize the key takeaways for today's session is I want you to go to Telegram after the session. Take just 1 minute to tell us what you gained out of this session, why it's important to participate in this experience sharing session, so that we may encourage our peers. We may encourage our peers to join next Tuesday at 5 p.m. Geneva time for the next experience sharing session, which is very important, because we are learning We are learning today. We got insights, we got experiences shared from Nigeria, from Cambodia, from the Gambia. So encourage others. Leave a message on Telegram channel to say why you find this experience sharing sessions worth organizing and worth attending. So I'm turning over right now to François. François, what are your key takeaways for this session?
I think, thank you, Charlotte, and thank you to all people who have shared their ideas and their challenge. I think the first thing that we heard was about the default tracking and using the modern technology, which is SMS, and it proved to be useful. And we know that in many of those, on your country, there is a phone availability. And I think it is extremely important to use all the tools available. I think we have heard after really the problem of sustainability when you achieve something, and sustainability both technically in terms of support and in terms of financial, knowing we all, I think all your countries face donors, NGOs who drop after a few months, after a few years, and you're left without money to continue. Something extremely important you all have mentioned is outreach to reach the non-reach so far. And I think outreach is maybe one of the key messages from that session, but outreach requires logistic people to support and reach this community, and communication, that's what we heard, to make sure that there is a demand and when the outreach team comes. I think we have heard that you need to look at short-term and long-term. We heard that making sure the government will take over. So it's in your planning, it has to be very, very clear. We heard of some approach, interesting that no money from donors is there's not a little bit of money putting by the government on long term in the plan, the 2-year plan, the 5-year plan, but the risk is very high if sustainability is not addressed, and there's a tendency to focus on short term and not on long term, and both should be addressed together. So, and I think partners, governments are all a bit guilty for the lack of long-term sustainability funds, but we have heard some great ideas and management in Cambodia, where it's a word, the key words coming, integration, that for those outreach, or for reaching out to reach, seems to be by everybody. You need to integrate several interventions. It may help you to get the money, and EPI alone will be very hard to sustain in those hard-to-reach areas. Thank you, Charlotte. Thank you to all for your contribution. It was fascinating to listen to your stories and your success stories. Thank you.
Thank you, François. Thank you, everyone. And if you have technical problems getting to the platforms, rendezvous tomorrow at 1:30 p.m. Geneva time. So that is GMT +1. Looking forward to seeing you tomorrow. Looking forward to seeing you on Monday, and to seeing most especially your ideas in the ideas engine. So until then, bye for now. And thanks, Reda, for being with us as always. Bye. I'm going to ask everyone to unmute. So please, if you can just, I'm asking everyone to unmute. If you can just begin to clap for all those who shared. Put your hands together for all those who shared their experiences. For yourself for participating until the end.
Everyone.
Presentation.
Nice to meet you. Hi, bye.
Thank you very much.
Bye.
See you.
Nice to meet you.
Thank you very much.